Hello and welcome to Volusia Magazine. I'm Amber Osman. In this week's episode, the City Island Library reopens with a brand new play yard. There's a how-to seminar you've been waiting for, and we have ways to stay safe at the beach. Later on in the program, Joanne Magley gets a checkup on the county's health from Patricia Boswell, administrator for the Florida Department of Health in Volusia County. Those segments and more coming right up on Volusia Magazine. I hope you stay tuned. The Daytona Beach Regional Library at City Island is back and better than ever. More than 300 community members turned out to celebrate the reopening of the popular downtown library, which has been closed since Hurricane Irma flooded the facility in September. The revelers had double the pleasure as they also got to try out the library's new Rachel Robinson play yard.
It's such an honor to live in a community that values the children and want to make sure that we have a rich heritage for them to enjoy. This play yard represents that. And I'm so proud to be a part of this historic moment.
The reopening of this popular library is celebrated today. Long time coming for many of you. I know I started receiving emails a month after Hurricane Irma. When are you going to get it open?
You know, we closed because of flooding, and there was a lot of work that had to be done by vendors and our staff. And I think when patrons come into the library, they're going to think they've entered a new library.
And I want to thank two people in particular who represent the very best of our community in the persons of Josh Wagner and Kelly White. They both are parents of young children. And in their design and thought process of this project, certainly they were thinking of our posterity, thinking of our future, and thinking of preparing Daytona Beach and Volusia County to become a better place to take care of our children.
I'll pause just for one moment to tell you that somewhere in this timeline, I can't exactly remember when, I gave birth to triplet daughters. And very quickly, this professional project became deeply personal to me. So today is a sort of Christmas for me, and I know that I'm not alone. The library is a true community treasure, and the children's department is like none other in the entire county. Now with this dynamic outdoor space, the families of Volusia County can have a beautiful, safe place to bring their families.
You see things differently when you have kids. It just happens. You think you know what it's going to be like till you have kids, and you're like, wow. A lot of times, and talking to everyone at the library, a lot of parents have their visitation here at the library. So when you see a dad or a mom with the kids, was having that respectful, loving environment for kids, even just like my kids, can go play on a playground and have the dignity of a real time with their kids, and I thought that was important.
There is nothing more essential to the development of a child than these two facilities. When you bring those two things together, reading and playing, therefore developing an imagination that will take Daytona Beach and Volusia County far into the distant future, a distant future that we cannot see. But because of their dreams, their imagination, their creativity, their ability to understand ideas, we will be a better and a greater society for it.
The play yard was named after Rachel Robinson, who was married to baseball legend Jackie Robinson. While honoring his memory, Mrs. Robinson made her own way as a nurse, professor, and civil rights activist. Children and their parents will be able to access the play yard through the library during regular library hours. After the county and city officials unveiled a plaque honoring Mrs. Robinson, the children charged the play yard and had loads of fun on the new playground equipment.
So today we thank you for celebrating Rachel Robinson's life and that legacy with all of us today. Be blessed, my friends. Thank you.
Local experts, hobbyists, and professionals will share their passions and offer instructions during more than 100 free programs at the 6 regional branches of the Volusia County Public Library System. The county's first ever How-To Festival will run from 11 a.m. to 3 p.m. Saturday, May 19th. During this interactive community education event, attendees can learn everything from how to braid hair to how to run for office and how to belly dance.
So this is a special event because in a very short period of time, patrons will be able to come into any of our 6 regional branches and take part in the festival. Libraries generally throughout the year have free programming both by our talented library staff and from community members. This allows us to showcase both our community and our libraries in a way that we come together in a short period of time and have some fun, learn some practical skills, things that people might want to try but have never tried before. You'll get to know people, you can chat, you can talk about the craft. If it's something real new, maybe you can get advice on how to get started. If you're somebody who's been doing it all the time, you'll learn some new things and really enjoy that. It's a nice community of people for a whole afternoon, sharing the experience of doing something they love.
Library staff will also offer technology classes that will cover the library system's databases and downloadable materials. The How-To Festival will be a lot of fun, and we encourage residents to join us at the library. For a complete list of programs, visit volusialibrary.org. The Department of Health in Volusia County is responsible for protecting the community from public health threats. Recently, the agent put its emergency plans into action. Dr. Holly Smith gives us an inside look at how the agency may distribute medications to the public if there were a threat. Fortunately, this video is from an exercise and not a real threat.
This is good medicine.
This is good medicine.
And I'm not going to die.
You're not going to die.
Anxious patients like this one would be plentiful if the community was exposed to a biological attack. Fortunately, this woman is an actor, and this is video from a drill held recently at the Department of Health in Volusia County.
I'm supposed to give this to you. I'm not sure. I don't know. They just told me to come in here.
Sure.
And I don't know what I'm supposed to do. I don't even know why I'm here. Why am I here?
We're giving out medication for exposure to anthrax.
Anthrax?
So
stuff from like 2004?
Drills like this are used to practice a response to an emergency. In this exercise, several thousand people were exposed to anthrax. To prevent those exposed from developing symptoms, the department dispensed medical countermeasures. In this case, antibiotic medications were dispensed to counter the effects of a potential exposure to anthrax.
Okay, ma'am, I've got the doxycycline for both Anita and Ken in the bag. I've got a sheet on doxycycline, how to take the medication.
For this drill, the department was given just a few hours to set up an operation to distribute medications following that fictitious attack. A large conference room turned into a pharmacy. Actors played the role of victims. First, those actors were triaged to ensure they did not have any allergies to the medications being provided.
You don't have any allergies?
I don't.
Okay, so you're good.
Yes.
And this is your husband, John?
Yes, this is my husband, this is my son.
Okay, and he's allergic to doxycycline?
Yes, he is.
What kind of reaction does he have?
He itches, he gets rash like hives.
Okay.
He just...
And what about the Cipro? Is he allergic to it?
No, it's just this.
Looks like everything is a go.
Once all allergies were accounted for, the victims were led through an assembly line to receive the appropriate medication quickly and efficiently.
I need the medication. Okay. Apparently I have this in me. I don't know what's going on. Somebody direct me to where I need to go.
Yes, ma'am. We'll take you right over here. There's no wait, and they'll be able to provide you with your medication.
Once someone has picked up their medication, they come over here to the education table where they can get their questions answered about the medication or whatever they may have been exposed to.
Hi, ma'am. How are you today?
I'm well. How are you?
Well, do you have any questions about your medication?
A lot of work goes into drafting the plans for a response like this. A lot of preparation also goes into conducting exercises to test those response plans, and a lot of coordination is needed on both accounts, the planning and the exercising, to ensure the department is able to respond quickly and efficiently to all public health threats.
This is a combination of local, state, county, and volunteers, including some of our local students, working together to actually run through this exercise to ensure that all of the functions that need to be available are working to be successful in determining whether or not we have a capability to do this type of response.
Now that the department has tested its procedures, staff will look at what they did well and the areas for improvement. Then the emergency response plans for all types of public health threats will be modified to improve the agency's response.
There's a strong evaluation component to this because we really do need to test everybody's role and responsibilities, ensure that the timing is adequate, because it is certainly all about how timely we're able to administer an antiviral drug or a vaccine in response to the threat.
The Department of Health will get the opportunity to test these same plans again next year. That's when the agency will participate in another exercise that will stress this system even more. It's practice like this that helps public health officials to hone their response to an emergency. If you have a medical background and would like to volunteer for any disaster or emergency right here in Volusia County, you can find information on how to do that right on our website. The address is mrcvolusia.com. For the Florida Department of Health right here in Volusia County, I'm Dr. Holly Smith.
They said I couldn't dream. Called me a piece of trash and swore that's all I'd ever be. Said a bottle couldn't see the ocean. Give up. Go back to the dumpster. But I didn't listen. I made my way. And now, I am what I've always wanted to be.
With Labor Day weekend on the way, thousands of people will be heading to the beach. And while the water and waves may look inviting and fun, beach safety has been consistently flying the red caution flag, which means hazardous rip current conditions. Rip currents are channels of fast-moving water that can pull even the most seasoned swimmers away from shore. Nationally, more than 100 people die every year from rip currents, more than shark bites, tornadoes, or hurricanes. More than 80% of beach rescues are attributed to rip currents, according to the U.S. Life-Saving Association. In 2017, Volusia County lifeguards rescued more than 1,400 swimmers from rip currents.
That's why it's extremely important for you to swim in front of those open lifeguard towers. A lot of times those tower guards will see you being pulled out in a rip current before you actually realize it yourself. Do not ever fight the current. That's when people drown, they get exhausted, and they keep trying to fight the current and come in. A lot of people, I tell people and kids, just float. Everyone can float. So you float and somebody will be there surely to help you, especially if you're in front of those open lifeguard towers. Like I said, that's probably the most important thing to remember when coming to the beach.
If you see someone in trouble, don't become a victim too. Throw the person something that floats, get help from a lifeguard, or call 911. Beach Safety offers many safety tips for beachgoers. If in doubt, don't go out. For more information about beach safety, you can visit volusia.org/beach. Floridians enjoy year-round growing opportunities for fruits and vegetables. In this week's Solutions for Your Life, Joe Seward's UFIFAS Extension Agent has the details on what best to grow for a successful summer harvest.
Oh, hi there. I'm Joe Seward, and this is Solutions for Your Life. As you know, I talk a lot about edible crops and edible gardening and edible landscaping, and now that we've planted everything, hopefully things are growing. It's time now to start harvesting. So let's talk about harvesting, getting ready for the summer. Let's go. There it is, the elusive white carrot. It's potato digging season. And these are potatoes that we planted last February. Hydroponic lettuce. We've been in there 3 weeks. So here we are in the kitchen. We're ready to start cleaning and prepping our food for lunch or supper. So this is about what 5 minutes worth of work will net you if you have a very active and successful vegetable garden. Not everything that you're going to harvest is going to be perfect. It might not be restaurant or grocery store quality, but it is certainly edible and beautiful just the same. For example, here's beets. You say, well, that's an awfully small beet. But what we're going to do is we're going to chop up the beet leaves and use these for greens in our salad, which will include romaine lettuce. Plenty of romaine lettuce. And what I did here was just picked enough leaves for me to have a salad. So if you have 2 or 3 or 4 people, pick a few more to leave the plants to grow until they're expired. So sustainability there. Here we have some fresh sweet corn straight from the garden. So this corn may not be what you typically find in the grocery store because this particular ear is not really big, but as I open it up, as you can see, it's a beautiful bicolor. Since we've raised it out here in our own garden and we have been practicing integrated pest management, we didn't have any need to spray it with any kind of pesticides. So I'm able to pick this. I don't even have to wash that. And if you want, you can eat it right off the cob. You don't have to cook it. Potatoes, straight out of the garden. These are the potatoes that we planted in February. Here we are at the end of April, the beginning of May. We'll be harvesting potatoes for the next week or 2. Wax beans. Eat your colors. We have purple beet greens, we have green lettuce, we have bicolored corn, we have white sweet potatoes. Here are yellow wax beans. This is one that's very interesting. You say, well, why is it growing in a styrofoam cup? This has been growing hydroponically. We planted this lettuce 3 weeks ago in a hydroponic system. 3 weeks, and we've got a usable head of lettuce. So what I'm going to do to harvest this, again, it's clean. There's no dirt other than what's on the roots. I cut off the roots. This goes to the compost pile, as do the roots from the potatoes, because we recycle everything. And composting is a way to recycle. So let's talk about carrots. How many of you have seen a white carrot? How many have seen a red carrot? And everybody has seen the orange carrots. And again, here are a couple of carrots that you won't find in the grocery stores. There's nothing wrong with these. How many recipes do you cook with that use chopped carrots? These may not be aesthetically pleasing, but they're perfectly edible and perfectly fine. Cut them up, use them in your recipes, and then, of course, you'll have your own share of quote-unquote perfect carrots. What is more satisfying as a gardener than to grow and harvest your own food? This is the harvest season. If you have a vegetable garden, now's the time to start pulling things out of the ground. Make your plans for the fall garden And also get ready to solarize your gardens over the summer. As we know, it's really hot and humid here. Our next segment will be about the summer vegetable garden and what we do here in Florida in the summer. Thanks for joining me. This is Joe Sewards for Solutions for Your Life.
And now let's join Community Information Director Joanne Magley in the studio with her guest, Patricia Boswell, Administrator for the Florida Department of Health here in Volusia County.
Thanks, Amber. Well, each year, the Robert Wood Johnson Foundation at the University of Wisconsin conducts a health indicator survey in every county of the United States. So joining us today is Patricia Boswell, the Health Officer of the Florida Department of Health here in Volusia County. Hi, Patricia.
Good afternoon.
Thanks for being here. So tell us about this Robert Wood Johnson Foundation and the survey. What does the survey measure? And tell us about the foundation.
Well, basically, the Robert Wood Johnson Foundation is looking at improving the health of our nation. And the best way to have an impact on that is through data and understanding where we are, how healthy is our country. And they take all of the counties in the nation and they create this county health ranking for each state. So it allows Volusia to see how we compare to the other 66 counties here in Florida. And the main two measures of health in this report is around how long do our residents live? What age does death happen? And how healthy are they? Those are the health outcomes. And what influences that are health factors. And the health factors consist of the clinical care, our behavior, our environment. And what we know now is it's about where we live that influences our health.
So how does Florida rank among the other states, and then where does Volusia County come into this whole ranking?
So basically, the report that I reviewed was comparing the counties in Florida.
Okay.
So I think Florida, I would just say nationally, you probably rank based on how many people are insured versus uninsured, and we probably have a higher uninsured rate than some of our other states. But as far as Volusia in Florida, we're 44 out of 67.
It doesn't seem where we want to be.
No, we want to be closer to 1. And basically, the data is data that's compiled looking at a number of different health influences, such as I mentioned the uninsured rate, employment, housing, behaviors like smoking, alcohol use. So there's a number of factors that go into describing where we are in terms of that number.
And I think one thing that this study really shows is that there's definitely a correlation between good health and then personal income and then education status as well. Those things all combine to a healthier or not so healthy community.
Yes, so it's the social determinants of health. And you can look at certain communities and look at the data around infant mortality, for example. And so even though the infant mortality rate may be declining in Volusia, certain groups, particularly Black women, have a higher rate than white women. And so why is that? Hopefully they're getting into prenatal care. But for example, if I don't have access to healthy foods, maybe I'm smoking, those things will overweight, obesity. We have, way too many adults that fall into that category. All those things are going to influence the pregnancy and the birth outcome. So basically, if you're living with a lot of stress, you're afraid of where you're going to be living, you might be in fear of losing a job, you might not have enough income to support your family, even meet basic needs, that's going to influence your health as well as the baby's health.
So there are some things in our community that are pretty positive, such as we have access to good health care. We have two major hospitals and then other healthcare facilities in Volusia County. We have an extensive trail system. We have opportunities for people to do things outdoors. How does that affect the health of Volusia County? I mean, it's a positive, really.
Yes. So we know that clinical care contributes to 20% of our health factor score. So really, how often you see a doctor influences a person's health only 20%. You know, that's not really going to decide how long I live or how healthy I am over the course of a lifetime to the degree that I think most people think, because it really depends on those other behaviors. Am I outside exercising? What is my weight? What am I eating? What type of stress is going on? What kind of job do I have? Am I able to afford basic needs? Am I providing for my children? Are they going to school? Are they graduating? Who's going to college? Because again, that drives how much we earn as adults. So I think those things have to be really taken into account. But I think Volusia is in a really great place in terms of making some positive outcomes and increasing where we are in the rankings, because we do have an extensive trail system. Our parks are beautiful. We live along the ocean. We have the river. So if people want to get outside and exercise, it is available for a lot of our residents. The economy is improving. People are getting more opportunity to get full-time jobs, maybe with health insurance and things of that nature. We're working together in partnership. There's a lot of both at the government and nonprofit agencies working together to make improvements and have impact on people's lives, positive impact.
And you know, you mentioned that businesses, employers really have an opportunity here to help their employees, you know, by having specific things in their health plans that allow folks to become healthier just because of the health plan that they're providing for their employees.
Yeah, and I think the insurance industry has already taken full advantage of that and saying that, you know, like look at Medicare and Silver Sneakers. They'll definitely cover gym memberships, encourage healthy eating in the workplace by having better choices, whether it be at a snack bar or in a vending machine, support their employees in their attempts to quit smoking. I think all of these actions by our employers will again continue to help improve the health of the residents of Volusia. And again, we have to make sure that we take into account that the data is usually 2 to 3 years old when we're looking at 2018. So changes that happen today we'll see in a year or so.
Right. And the program that you mentioned about pregnancy and the incentive for the parents to stop smoking, that's relatively new with the Department of Health.
Yes, we've had 20 pregnant women participate in that program because we know that for families that can't meet basic needs, the cost of diapers can be a hardship. So we thought that if we could pair the two together, help the families in getting those vouchers, but also support them in their attempts to quit smoking, we'll have better birth outcomes and healthier babies and healthier families.
Okay. Well, you have a lot of information on your website, volusiahealth.org, right? All right. Patricia Boswell, the health officer for the Department of Health in Volusia County. Thank you so much for being here today.
Thank you.
Amber, back to you.
Thanks, Joanne, and thank you too for watching Volusia Magazine. If you have any questions about the show, you can feel free to give us a call at any of the numbers you see listed here, or you can log on to volusia.org and click on the News tab at the top of the screen to find us. And we hope you won't forget to listen to Volusia Today. That's Volusia County Government's weekly public radio broadcast. Volusia Today airs every Tuesday, Wednesday, and Sunday mornings on the local radio stations you see on your screen. For Volusia Magazine, I'm Amber Osmond. Have a wonderful evening.